Hi, so you're watching this video probably because you just had laser lithotripsy. So just to go over postoperative expectations, you probably do have a stent if this was scheduled from the office. If this was a procedure that was performed emergently through the emergency room because you had a stone that was stuck and it ended up with you in the hospital, maybe you don't have a stent. Or if this is a procedure that was scheduled as a result of a stent that I put in the hospital for an infection, and later on we came back to take out the stone, you probably don't have a stent in that scenario either. So for all comers, for the first 48 hours, you're probably going to have some discomfort in the area of the kidney and also in the bladder because we went up there with a scope. You may also have some pain with urination, and that's from the irritation that the urethra experiences from the scopes passing in and out of the bladder. I do prescribe medicines for all of these things. I generally prescribe 5 medicines after a laser lithotripsy. I try not to prescribe narcotics like Percocet in this scenario. It's been shown that really it can be avoided. So, but I do prescribe 5 medicines, and those are Motrin. If there's no contraindications, I do give 24 hours of antibiotics. There's no evidence to continue for more than 24 hours. And there's no evidence that less than 24 hours is better than 24 hours. So I do 24 hours. I do a stool softener, and that's because everyone who has these procedures gets constipated after. So I would definitely get started on that. I give a prescription of Flomax, and the reason for the Flomax is usually we're prescribing that for the prostate, but in this case, what it does is it relaxes the ureter tube and allows things to pass. So it allows urine to pass. It allows little fragments, itty bitty sand particles that are left behind to pass. If you have a stent, it helps with the discomfort from the stent because it keeps the ureter from contracting against that stent because the ureter has a lot of smooth muscle and it can cause pain. You can have pain with the ureter kind of contracting against that stent. So it helps with all that. And then I give a prescription of pyridium, which is essentially over-the-counter azo. It's going to turn your urine really orange. What that is for is the pain with urination, the actual irritation of the urethra. It's kind of a numbing agent on the urethra. So I give you those 5 medicines to help with the discomfort. If you watch the prep video, you're aware of kind of stent expectations. If the urinary frequency is really bad and there's no issues with the bladder outlet, then we can add a 6th prescription of oxybutynin, which is a relaxant for the bladder, so it's not going to the bathroom as often. I do prescribe that sometimes right up front for women. In men, I am less likely to, and that's because men can have trouble with urinary outflow after a procedure where, because they do have a longer urethra, they do have a prostate. I just went up there with a scope, so you're already kind of a setup to not empty your bladder. And if I give you this medicine to relax your bladder, that it's not contracting as well, maybe you're not emptying well at all, and now we have a whole other problem. So a lot of times I don't prescribe that medicine, but I can if it's really bad. We can try it, and just call and we can try that. But generally, I do the 5 medicines. You are going to see blood in your urine for sure. You may even see some small clots, for men because the prostate can bleed a little bit. You shouldn't have large clots. If you don't have a stent, your bleeding should subside in a few days. If you have a stent, you can expect blood off and on until the stent comes out. And that's because food, basically the blood is kind of like food coloring. It's just one little drop can turn the urine all red. And again, that ureter is kind of sometimes contracting against that stent, and it can cause a little bit of bleeding in the urinary tract, and it can color your urine red from time to time. It really is nothing to worry about at all, especially if there's no clots associated with it. It is a tiny, tiny amount of blood. It's not going to affect your blood counts or blood pressure or anything like that, especially if there are no clots. And even if there are some small clots, that's fine. If there are big quarter-sized clots, please call. That's a whole different problem. And then we will have you back in a week for the stent. You should already have that appointment to get the stent removed. So we'll see you back at that time. Once the stent comes out, you can then again expect some bleeding for a couple more days. And then finally, everything kind of will subside. Once the stent is out, and if there's no stent at all, then things kind of progress very nicely, because there's very rarely an issue with stone fragments getting caught in the ureter. That's like a less than 3% chance. That would be big enough that we'd have to go back in and do anything about. Usually kind of the stent comes out and you feel much better the next day. So people always ask me about work expectations. If you do not have a stent, you can probably go back to work in a couple of days, maybe 3 days. If you have a stent, I would just tell your employer you're taking a week off. You can try to work. I mean, if you're self-employed, I get it. I totally get it. But otherwise, just take the week off. And then when the stent comes out, maybe the next day, take that off, but then you're good to go. I mean, pretty soon after, you should be really back to normal. I do get an ultrasound 4 weeks after, and that's to allow kind of the fragments to settle out, everything to pass, all the dust to pass. We'll get an ultrasound and see how we did, make sure there's no backup of urine, make sure they're, see what the kidney looks like in terms of remaining fragments, and go from there. So again, if you do have the one thing that we do worry about most actually isn't necessarily bleeding or discomfort. As urologists, after this procedure, we do worry about infection. Like I said, preoperatively, there's a 2% risk of infection. If you do have an infection and you're having fevers, if you're having fevers after this procedure, I would just go to the emergency room. I'm going to ask you to go to the emergency room. If it's over 101, just go to the emergency room. That's a 2% risk, but when it does happen, we need to get the antibiotics started right away. So that's the main thing we really worry about. So if you have any questions, please call. Otherwise, have a nice day.